Okay, so good afternoon, everyone, and thank you for joining us for another one of our free math educational seminars. Today we have Dr. Kinsella, clinical psychologist specialist, and the session today is about managing workplace bullying claims. Dr. Kinsella is a Melbourne-based clinical psychologist and co-founder of CB Consulting and Mesh Health. He has worked with children, adolescents, and families and held senior roles at Albert Rowe Centre and Austin Health. He served as chair of the Melbourne Branch of the Australian Psychological Society and deputy chair of the Psychology Board of Australia. He also regularly appears on Australian media and has advised on documentaries like How Mad Are You and Addicted Australia. He is currently an independent director at the Australian Association of Practice Managers. Now, may I ask that you all please remain on mute so that the noise from your home and workplace does not affect the quality of the recording. Then you will be able to unmute and ask questions at the end of the presentation, or you can type your question in the chat so I can help you if you need to go or don't want to speak up. The recording will be sent out to you within a day or so, along with the slides. Without further ado, I hand over to Dr. Kinsella. Thank you so much for giving up your time today to deliver this session for us. Over to you, Doctor.
Thank you for that. Before I start, just in the spirit of reconciliation, I'd like to acknowledge the traditional custodians of the country throughout Australia and their connections to land, sea and community. We pay our respects to the elders past and present and extend that respect to all Aboriginal and Torres Strait Island peoples today. So Jasmine's given me a great intro, so I probably don't need to go through my background much more, but I would just say that I'm approaching this presentation today mostly from the perspective of a treating practitioner more than an independent medical examiner. I've been practicing in Melbourne for over 30 years now and worked in a variety of different contexts, but mostly in private practice, working with more of an adult population, so people who are in the workforce. And obviously bullying is one of those issues that keeps presenting itself. My practice is right in the CBD of Melbourne, so we get a lot of office-based workers, so more so that kind of demographic than, say, the tradies. But we still do provide employee assistance programs to some blue-collar organisations. So we have some civil construction workers, builders, and so on. So we do get a bit of a mixture of presentations and see bullying sort of manifest in those different types of organisations. I would just also make a note that during this presentation, I will be talking about serious mental health problems and suicide. If this is going to be distressing for you, you might want to tune out. That's perfectly fine if you feel like you need to leave the presentation. I think the slides in the presentation will be made available to you at a later date. So if you want to look back over the presentation when you're feeling more comfortable to do so, that's perfectly fine. But also, if you're feeling like you need any more immediate help, you might want to think about speaking to someone within your own organisation, perhaps, or an employee assistance program provider, your GP, or Beyond Blue Lifeline or suicide callback line. So those details are there if you need them. But if you're finding any of this distressing, if you want to let me know, that's also perfectly fine to interrupt. And as far as interruptions go too, I'm very happy to take questions at any point during the presentation. So first of all, today I'm going to be so I'm just going to try and move my display a bit. I'm going to be talking about the response to bullying rather than prevention. There's a lot that could be discussed with respect to prevention, but that's a topic for a different presentation. The response to bullying really is so important because we know that the consequences can be so severe. At the very minor end, it undermines self-confidence, it reduces performance at work, it can lead to minor mental health problems. For those of you on this presentation who aren't mental health practitioners, you may or may not have heard of terms like adjustment disorders. Adjustment disorders are what I call the entry-level mental health problem. So most people will experience some difficulty with adjusting to circumstances at different points in their life, and that can be specific things like the stress associated with bullying, and bullying often leads to anxiety and depression, and people sometimes manage that with substances, drinking more, taking recreational drugs, and obviously at the worst end of the spectrum can lead to suicide. And I'm not sure how many of you are familiar with Brodie Panlock's case that occurred in Victoria, I think in the last decade or so, where she was working in a cafe in Melbourne. She was bullied relentlessly for an extended period of time. Her employer failed to act, and sadly she took her life. And so we now have Brodie's Law, which makes that kind of bullying illegal and can lead to prosecution. So it is obviously something that has very serious consequences and needs to be dealt with appropriately and accordingly. I tossed back and forth about whether or not to include the definition of bullying, but I thought in the end we may as well just recap. Bullying obviously is deliberate behaviour, it's hostile, and there's types of bullying that are very obvious, like verbal or physical abuse, even abuse in emails and text messages and those kinds of things. And they're obviously very confronting and very damaging forms of bullying. There's also perhaps more subtle forms of bullying, like surveillance or monitoring, deliberately withholding work-related information to make people's work harder, unequal application of rules or benefits, or isolating employees from others. These things can be hard to pick up and hard to really know whether they're actually happening, which is part of the it contributes to the damage, I suppose, that those forms of bullying do, because workers often find themselves in a position of second guessing whether these things are happening or not, and whether the behaviour is actually unreasonable. And often along with these behaviours, there's a bit of gaslighting that goes on too. If workers might confront their managers or their leaders about their concerns, only to be told, no, there's nothing happening. This isn't happening to you. It's just the situation, when actually it really is happening, and they really are being, say, isolated or being treated differently from other co-workers. What I'd say also is just a reminder that bullying is not giving reasonable direction. So it is appropriate for employers to give direction to their employees. It's appropriate to go through performance management processes. There's a number of other adverse actions that employers can take that are perfectly legitimate and reasonable, but it's these kinds of behaviours that we're talking about today. I'd also like, as I go through this, for you to keep in mind different scenarios. So obviously we have the scenario where we've got genuinely bullied people. It's psychologically affected them, it's been reported, and it's clear that that's what's going on. Then we've got scenarios where people present as feeling that they have been bullied, but the behaviours don't meet the criteria. So that might be, for example, a scenario where a worker feels like they're being asked to do unreasonable tasks, or they're being asked to work harder than other people, perhaps, but there's no evidence that what they're reporting actually meets those criteria. And then the third scenario I want you to keep in the back of your mind as I'm talking is that we obviously have vexatious or malicious claimants, people who've just taken a dislike to their boss. Sometimes people who are just looking for an opportunity to tap into the work cover system and, are clearly trying to find their way into compensation. In my experience, that's a really small proportion of the population. I would say it's probably around 1 or 2% of the people that present to me, either for therapy or as in the IME context. But they do exist. There's no question. And then the other scenario is the other side of the coin, I suppose, is the alleged bullies themselves. And again, there's three categories I want you to keep in the back of your minds. There's the people that the individual is oblivious to their impact on other people. And these are people sometimes who believe that they have the right to act however they like, that they're the boss and that everybody has to do what they're told. And, you sometimes see those people saying, well, the employees are incompetent, they're idiots, they'll be quite aggressive in the way they talk about their staff. Then there's people who are also oblivious to their impact on people, but they'd actually be mortified if they really knew that they'd cause distress. They go about their job with perhaps a sense of purpose, and they can be very forthright, perhaps, or very blunt, but they don't mean to give offence. But some people find perhaps their bluntness, for example, really difficult to deal with, and it sometimes leads to bullying claims. And then the third example or third scenario I'd like you to keep in mind is that situation where the individual's not actually bullying and it is a vexatious complaint. And it's important to consider both sides because employers have to provide a safe workplace for everybody. That includes the people who are complaining about being bullied, but it also includes the people who are being complained about. And you can see perhaps in that third category of alleged bullies that those people could be, or perhaps the second and third, both those categories of people could be very badly affected by receiving a bullying claim against them. So, like I said, just keep that in the back of your mind as I go through this. So remember that bullying can lead to loss of self-esteem and confidence and productivity. Many people, if they're feeling bullied, will find it hard to go to work. I've had very many clients over the years who say they get so anxious about going to work that when they wake up and think about going to work and they physically vomit because they're so anxious about going to work. And obviously, if you're in that state of mind in the morning, then it's highly likely that your sleep's going to be affected. It's highly likely that you're going to feel anxious a lot of the time. Depending on the severity of the bullying, too, post-traumatic stress disorder might be a response to that bullying, particularly if the bullying is physical in nature, and that's perhaps something you see more with trades where they might haze employees and play practical jokes on them. Well, they see them as practical jokes, but it's really bullying. They in those scenarios, the workers can actually fear that they're going to be quite severely physically injured or maybe even killed by the people that they're working with. And of course, there's the direct impacts that can cause things like anxiety, depression, panic, adjustment disorders, and so on. But as I said before, workplaces have to provide safe workplaces for everybody, and that includes people coming into the workplace with a pre-existing mental illness. So you might be working with someone who has obsessive compulsive disorder or an eating disorder. You might be working with somebody who has schizophrenia or bipolar disorder. These things are not written across their foreheads. But yeah, and so there's no way for people to know that they're experiencing those things. But those conditions can absolutely be exacerbated by bullying. And then physical health is an interesting one. Again, if you're not mental health practitioners, you might be a bit curious about how this is connected. But psychologically, if people are not good at expressing their emotions, if they bottle their emotions up, then those psychological reactions can be manifested physically. And many of us will have had stress headaches or tension in our neck and shoulders when we're under pressure. They're probably the most common forms of physical representations of stress. But it can be other things too, like shortness of breath, dizziness, and even gastrointestinal problems. Things like irritable bowel can be caused by bullying. Then there's changes in eating patterns, substance abuse, alcohol abuse is a big one when it comes to bullying, and social withdrawal. People who are being bullied often feel that they're worthless and that they may even get sick of talking about the problem, and so they want to withdraw from people. But also people who've had bullying claims made against them feel very vulnerable and start to wonder what other people are thinking of them. I've got one client currently that I actually saw this morning who has an outstanding bullying claim against her. She's one of those in that category where she's mortified that other people might think that she's a bully. And so she's now second guessing how she behaves and withdrawing from people. And then, of course, if it's bad enough, it does lead to suicidal ideation or suicide. And as I said, false claims can be just as damaging. So both the person lodging the complaint and the alleged bully need the support of the employer. So what are the first steps? Well, the first thing is obviously to make the situation safe. And in order to do that, you need to discuss the options with the complainant. You need to find out what exactly is going on in the situation and how they imagine the workplace might be able to adapt or address the issue. And that could be anything from the complainant saying, I want a mediator, or I just want to raise it. I just want to put it on the file that I'm experiencing this kind of behavior. It could be the complainant saying, I don't want to work with that person anymore, which might mean that somebody has to be moved to a different task. Where possible, if some sort of workplace mediation can occur, I always think that's the better scenario. In many cases, there's not that many cases of the extreme where the bullying is deliberate and malicious. It's more common that it's unintentional, and there's personality differences in the way workloads managed, for instance, or the way people conduct themselves. And a mediated solution can lead to much better long-term outcomes, both for the complainant and the alleged bully. Obviously, in more hostile scenarios, you might need to consider leave for the complainant or the bully. Where leave happens, though, it's really important to talk to both about what kind of support they would like while they're on leave, and to have an agreement between them between the employer and the person on leave about how much contact they want from the organisation and who they want that contact from. This is one thing that I see routinely handled very, very badly, that somebody goes off on leave and nobody contacts them. Not their manager, not their colleagues, not HR. They get nothing. And they might get an initial check-in to make sure they got home safely or something like that. but they can go for months without any contact from their employer. And the WorkSafe or workers' compensation processes can be slow, unfortunately, and so they have a very mixed experience with workers' compensation providers. And sometimes that involves turning over of case managers and people going on annual leave and those kinds of things, which just adds to the frustration of sort of being left in limbo. But if you can devise a support plan with either the bully or the complainant that is really clear about how often they'd like to be checked in with, how they would like that check-in to occur. Would they prefer a phone call or a text message or an email? And whether that plan needs to be adapted as time goes on. Those kinds of considerations can be really helpful in supporting the worker or the workers in those situations. And again, I think can lead to much better outcomes if both parties feel supported, if both parties feel that everyone's working towards trying to find a good outcome for the solution for the situation. Then, of course, there's the investigation, and most investigations follow predefined, transparent rules. I think organisations, smaller organisations, perhaps are less organised around this sort of issue, that they might not have policies and procedures in place. But it is important to have those predefined rules that are transparent to the workers so that they know what to expect. Where possible, the investigation needs to be as removed from the workers as possible, so independent people involved in the investigation. In larger organisations, that might mean finding someone from a different department who's got no contact or no experience with either of the workers. In small organisations, it might mean bringing in a third party to investigate. It's really important that they're comprehensive, that they take in as much input from the organisation and observers as possible, and that they really dig deep into both sides of the complaint to find out more, that as much information about both sides of the complaint as possible. And I'm going to use this example of today's client again, because it's a good example of where perhaps the process has fallen down. In this situation, she was told that somebody had made a bullying complaint against her, and she later found out through other workers that the only people who'd been investigated or who'd been questioned were people who were friends of the complainant. So there was a clear bias, and she found this out through somebody who I guess had been a supporter of hers at work, and that supporter said that neither he nor any of her other supporters at work had been questioned. So it was a very clearly biased investigation. Fortunately, that supporter said to the investigators that they must investigate and they must speak to these other people who have different experiences of the worker, so that they could give a more balanced picture of what might have been going on. And of course, timeliness is really helpful. The sooner the situation can be investigated, the better. It reduces problems with recall. It reduces the opportunity for workers to get together and corroborate each other's stories. It reduces distress to the victim and the alleged bully. And it reduces the scope for the alleged victim to sort of develop worse symptoms, and the alleged bully actually to develop worse symptoms. And again, I'm going to use this example. This lady's her case is being investigated for coming up to 5 months now, and she's not getting any better. And I'm sure that I don't know what's happening on the side of the complainant, but the alleged bully is feeling more isolated and more victimised by the process because the process has taken such an extraordinary length of time and inexplicable too. There's been no feedback to her about why this process is taking so long. So I'd next like to talk about support during the investigation. So if possible, if both the alleged bully and the victim can be given a clear outline of the process and include a timeline, that is incredibly helpful. I think in some cases, workplaces are reluctant to do that because they can't guarantee exactly what will happen. But uh, if you've set up already a communication plan about when each party is going to be contacted, that also gives an opportunity to talk about changes in the timeline. And changes happen for reasons, circumstances that are completely outside anybody's control. People who might be investigating, for instance, might get sick, might need some time off. There could be other disruptions to the process that slow things down. But if you've got regular communication going with all parties, then you can manage the expectations right throughout. And so I think while there's some risks in providing an outline and a timeline, if you've got that open communication going, and you can keep people informed, then people cope better. And both the alleged bullies and the victims understand that scenarios change, that situations change. But if they're kept in the loop about those changes, then they'll cope better. I think the other important thing to consider in the more difficult scenarios where it's clear that bullying has occurred or that the relationships have been damaged too much is whether or not safe alternative working arrangements can be found. Where possible, it's better to keep people working if they feel safe to turn up at work. So that might mean considering things like, can a person work from home? Can they work in a different department? Can they go on a secondment? And trying to put all these options on the table as early as possible. Again, keeping people in the loop, keeping them included in the process so that they feel like there is support there. And when I say safe, suitable working arrangements, I am also very much thinking of the alleged bullies, because until it's been established that they're bullies, they're not bullies. You have to be able to back this up. So there's a good chance that the person who's been complained about is one of those people who would be very distressed if they felt that people were upset about their behaviour, or that it's a vexatious claim and they feel attacked. Those people need support. And again, the workplace needs to provide a safe working workspace for them, just as much as they do for the person who's making the claim of bullying. It's a very difficult tightrope to walk to try to get that right, but very important for both sides. I've mentioned this before. If on leave, make a check-in plan, be clear about who they want to check in with them, and how often. Be clear also about the method, so whether it's phone call, text message, or email. My preference is always to try to persuade them to speak on the phone, because obviously there's a lot more you can pick up from tone of voice. Conversation, I think, builds a stronger rapport than text messages or emails. If you are doing phone calls with people, it's often a good idea to try to include in that plan that you'll send a brief email after a phone call just to summarise what's been said. Or just to acknowledge that the contact happened. So so there's clarity as the process moves on. And if you're dealing with a case like the one I'm dealing with at the moment that's dragged on for 5 months and is probably going to drag on for another 3 or 4, memories are fallible. So people forget about what kind of support they've had and who's reached out to them. So having that email trail can be very helpful. Again, for the alleged bully, go through that process of of clearly outlining the process and the timeline, manage their expectations, communicate with them. If you've got the communication plan in place, again, it makes it very easy to give them updates, to let them know of any changes or reasons for delays. The alleged bully needs support. And even if they were deliberately bullying, if they're facing disciplinary action, if they're facing being dismissed, they do need some support, rather than it being treated more as a criminal matter, I suppose. Of course, there are those scenarios where it is a criminal matter and police need to be involved, and that should be I suppose the last resort, but it may be appropriate in some situations. And once it gets to that level where it is a criminal matter, then the need to provide support changes. So if a worker gets charged with a criminal act, I don't think there'd be any expectation that the workplace should provide any support, that the worker's clearly broken the law, or has been had charges pressed against them. They need to find their own support, but they should be encouraged to find support. And again, for the alleged bully, finding safe, suitable working arrangements is really important. Keeping them, if they can be engaged and working productively in another department, and they can cope with that process of the disciplinary action going on, then that engagement with other people helps them to dispel some of the other anxieties too. So if they're feeling comfortable where they're working, if they're forming good working relationships with their new colleagues, if they're getting good feedback, even if they're able to reflect on their behaviour and think, oh, well, maybe I need to soften the way that I do things. That lived experience of doing it differently and of engaging with people and feeling productive again goes a long way to offsetting the sort of anxiety and depression that sometimes occurs when people are sitting at home waiting for some sort of outcome. The other thing I'd like to raise is just this idea of natural justice and procedural fairness. So natural justice refers to fundamental principles that ensure fairness in legal and administrative processes. While an organisation might not have clear sort of legal processes for these scenarios, it is important to get good advice about legal advice about how to manage these situations, because if they escalate, if they end up with workers compensation scenarios or fair work, if it ends up in litigation at some point, it's helpful for the organisation to be able to demonstrate that they've demonstrated procedural fairness, but it's obviously also psychologically beneficial for for both the complainant and the alleged bully to feel like they're being treated fairly. If either side feels like they're being treated unfairly, there's a high chance that their psychological symptoms will get worse. the complainants are more likely to feel like nobody is supporting them, nobody's taking them seriously. They're potentially going to get more depressed or more angry, depending on the scenario. And for the alleged bully as well, then there's a risk that they'll feel helpless, that they'll feel that again nobody cares about them, that everybody's taking sides against them, and it's more likely to lead to more protracted mental health problems and the need for longer term support as they start to rebuild their confidence. And in those scenarios where there is clear procedural fairness, if people feel like they're being treated fairly, what I've observed is that people usually do better. Even if the findings against them are adverse, they usually do better because they feel like, well, the process has been fair, it was timely, it was independent, it was well considered, the feedback was given carefully and sensitively, and I was supported through the process. Now I just have to move on with it. And that could be for the bully, the alleged bully, or the claimant. So I think sometimes people feel anxious about delivering an outcome that they know that the individuals won't be happy with. But if those sort of principles have been adhered to right throughout, then the outcome, the response is much likely to be a far more positive one. So we get to outcomes, reporting on the investigation. So when it comes to this part of the process, it's important to think before the report is delivered about how the report is going to be delivered, particularly if it's a finding that either party is going to be very unhappy with. They may need to receive that report or have that report perhaps sent to their psychologist to go through with their psychologist. They might need to go through it with a manager. But if it's a finding that is quite clearly going to be damaging to one party or the other, then they will need support. So if, for example, a claimant has developed severe psychological symptoms and the finding is that bullying didn't occur, then that person is going to need a lot of support to get back into the workplace, and to do it in a way that they feel safe. If, on the other hand, the alleged bully is found to have been bullying, then there's a range of reactions that can happen there. If they're that first type of bully that I mentioned earlier that believes they should be able to behave however they like, you can expect a fight from them. They will not react well. If, on the other hand, they're those other two categories, if they're the type of person that doesn't like to think of themselves as bullying, they'll be devastated to think that it's been substantiated. They're going to need more psychological support potentially, but they might also need some coaching around their behaviour so that it becomes clear, what the problem behaviours are and how they could manage them, and how they can manage them in different scenarios. The other element to reporting back on the investigation is to propose next steps. So rather than delivering a verdict, if you like, and saying this is going to happen, it's very helpful to propose, and this is part of the natural justice and procedural fairness element too, to say this is the outcome and this is what we propose to do next, and give both parties the opportunity to respond. Again, it's part of it. It leads to people feeling more included in the process and considered. And from a psychologist's point of view, in the treatment process, it leads to better outcomes for their mental health. because they do feel like they're part of the process. So, possible outcomes. So, as I said earlier on, I think one of the better scenarios is if you can get people to agree to mediation. And very often that mediation will involve a discovery of what the problem is. And the mediator, and when I've played these mediation roles myself, what I'll do is put the two parties in separate rooms, talk to them individually first, get an agreement about what the problem is, and then start to have a discussion about how they would like to proceed. If I can get them into the same room to then complete the conversation, that's the ideal scenario. It's not always possible, but ideally, if you can get them to share how they felt about what's happened, what they would like to happen next, and so on. Generally, I've seen better long-term outcomes, and I've worked with organisations where I might have done a mediation with them 15 years ago, and those people still work together happily because they've got through the process. Most people really don't like conflict, and they like to feel like there's some sort of resolution and they can move on, and that mediation process can be very powerful. If the organisation is large enough, redeployment can be a good option. It might involve it should involve some support for the people involved to make sure that they're happy with the place they're being redeployed to, and that they're settling into that new role. Anybody who's been on any kind of extended leave is going to need a graduated return to work. And very often workers underestimate this too, that they think, well, I just need to be able to go back to full-time work and I'll be fine. But they forget about the fact perhaps that they might have been on leave for 3 months, and returning to 40 hours a week of full-time work is it's tiring. It's physically tiring, it's psychologically tiring, and it's emotionally tiring for these people as well, because in the back of their heads, there'll be a whole lot of second guessing and anxiety and depressed sort of thoughts circulating around that they're trying to manage as they try to get their head back into the work. Obviously, other possible outcomes are criminal charges. Nobody ever wants to see those happen, but that does happen. And in scenarios where there's extended leave and extended psychiatric or psychological support, that often leads to independent medical exams where people have been on compensation for an extended period of time. If I put my independent medical examiner hat on, so when I play that role, I won't obviously have been the treating practitioner for either side. And for those of you who are not as familiar with the process, we're provided with a brief about the background of the situation, and sometimes that brief is quite short. It might be a few pages of information about what's happened. Sometimes it's very long as well. I've had IMEs where I've had to read 1,000 pages before I've actually been able to do the interview. So it varies dramatically based on the situation. As psychologists, one option we have open to us also is that we can use psychometric assessments. So some of those psychological tests can help us to ascertain whether the person might be faking good or faking bad. Usually in these situations, if they're faking either way, it's faking bad, because they want to exaggerate their symptoms for the sake of getting compensation. But there's other reasons why symptoms can be inflated as well. If they're more neurotic, perhaps, if they have an underlying personality disorder, perhaps, there are other good reasons why symptoms can be very exaggerated or seem very exaggerated. So it's the IME's job to try to determine to some extent what's gone on, but more specifically to try to understand the psychological symptoms that have occurred as a result of the behaviour, and to provide an opinion on whether the sort of symptoms that the person is reporting are proportionate to the problem, but also perhaps to provide some guidance about how the organisation could proceed to provide appropriate support to get the worker back to work. Okay, so I've just covered that, so there's probably nothing else I need to add to that. So that's probably about it from me. So I'll leave it open to questions now.
Everyone, does anyone have a question? You can type in the chat, or if you would like to ask, please unmute yourself.
That always happens when the presentation is very comprehensive.
Yeah.
Dr. Kinsella, that was really, really good. I learned a lot from that myself. I understand that we've actually got some questions from a couple of people who were unable to attend today. So, Jasmine, can I get you to ask those questions, please?
Yes, I think there is a question that really interesting when you spoke of natural justice, and that is important and only fair, but what if the complainants and the person allegedly being bullied doesn't want the bully to know that they have made a complaint or claim? So how should that be handled, doctor?
Yeah, I perhaps should have covered that, but that's an important part of the process. At some point, the alleged bully is going to need to know a bit more about how the complaint came about. And it's important because if an allegation's been made and that worker then has to return to the workplace, then it's going to be very difficult for them to feel safe in that workplace if they don't know enough about who made the complaint, or what exactly the complaint was. They need to basically be able to respond to what they're being accused of. And the other side of that coin, though, is that the complainant also needs to feel safe. So they need to feel that there won't be any retribution if they, if the alleged bully becomes aware of who made the complaint. So the early part of the investigation, to a degree, needs to make that to keep that confidential and to try to establish whether or not there is a risk to the complainant if the bully is informed of any of the details. But at some point, that person that's being complained about is going to need to know that this person or this group of people felt bullied by a particular set of behaviours. If there are concerns about retribution, then the organisation needs to manage that appropriately. So that might mean that, for instance, the person, the alleged bully, for instance, might not be allowed to attend the workplace. They might have their privileges revoked. If there's security cards or things to get them into the buildings, those access ports might be removed from them temporarily. And there might even need to be a formal warning that if they take any action against the person making the complaint, that will be dealt with very seriously as well.
Right, right.
Mm.
All right. Thank you for your answer. And here the second is, what do you advise in the situation where the employer and the alleged bully are prepared to apologize and support the person, but the person refuses to cooperate or claims they are unable to cooperate with a return to work situation?
Do you mean the complainant is not prepared to cooperate?
Yes.
Um, At that point, you really need to understand why they're not prepared to cooperate. It would be unusual, perhaps, for a complainant to reject an apology, but there could be scenarios perhaps where they feel like that apology is not going to be genuine, that it's just the organisation's way of sweeping the problem under the carpet. So it is really important to get to the bottom of why they're not prepared. And I would get an independent mediator or get a psychologist involved to try to get to the bottom of what the problem is, to create the right circumstances for them to return.
Okay, so last question is from me. So it's sad for me to hear about suicide stories stemming from workplace bullying, and I feel like people shouldn't feel trapped or helpless. I'm just curious that how often has suicidal ideation happened based on your experience so far?
That's a really good question, because there's such a spectrum with suicidal ideation. Very often people will think, oh, it would just be easier if I killed myself or something like that. And there's actually no intent. It's just a bit of an expression of this is, I suppose, of how paralyzed they feel by the situation. And you don't have to dig very hard to find out very quickly that there's no way that they would do anything to harm themselves. They're much more robust than that. So those kinds of thoughts are reasonably common, but the more extreme suicidal ideation is quite rare, fortunately. But that will also be affected by past experiences of bullying, past life experiences as well. If a person has been raised in a dysfunctional family where their parents have been abusive, for instance, and then they've been in abusive relationships as adults, or then been in multiple abusive workplaces, then the risks keep stacking up.
Oh, yeah, I got it.
So it
Thank
needs
you.
to be carefully assessed.
Yeah. All right, so thank you for that, Dr. Kinsella. I guess if there is no further question, then we need to wrap up here. Thank you so much for sharing your expertise with us today, and thank you to everyone who attended today. The recording will be sent to you within a day or so. Have a lovely, great rest of the day, and we look forward to seeing you at our next seminar. Goodbye.
Goodbye.
Thanks so much, Simon.
It's a pleasure. Hope that was what you were hoping for.
Pretty excellent. Thank you very much.
Right.